Well, let's go ahead and get started. Don't want to take up too much time or go over any more than we have to, but welcome to National Black Researchers Week for 2022. This is our special student session where we're going to be talking about transitioning from public health graduate student to public health professional. So we want to make sure that you are in the best position possible to be the public health professional that you were destined to be. My name is Dr. Joyee Washington. You can just call me Dr. Joy, and I will be your host for this session. So we're just going to give a brief session agenda, what we're going to cover today. I'm going to explain a little bit about my public health journey, and then we're going to talk about exploring public health research, kind of what that looks like. We're going to go over my top 4 tips to become a public health researcher, and then we are going to close with a very special giveaway. So who is Dr. Joy? This is me. I am her. So this is just my picture, and I am a pretty, if I would describe myself, a pretty simple person. I'm a very old soul. But first and foremost, that you should know is that I am the CEO of Joyee Washington Consulting. We are a public health consulting firm where we work to equip the public health workforce with research education and skill development to help fight inequities, take action, build impactful careers, and then bringing joy to the communities that we serve. But I can't be just about business all the time, right? So like I said before, I'm an old soul. I'm pretty simple. Some fun facts about me is that my hometown is Jackson, Mississippi. I am a Girl Scout for all of my life, grew up in Girl Scouts. And I say that because it plays an important role in my public health journey. And part of that is because when I was a Girl Scout, one of the things that I learned growing up was that you always leave a place better than you found it. So when we would go to camp and things like that, they would always tell us that. So if there's trash, even if you didn't put it there, you pick it up. You always leave a place better than you found it. And I always take that lesson with me, even in my public health career, because that's the goal. As a servant leader, we always want to leave a place better than we found it. Okay. Like I said, I'm an old soul. I always tell people I'm probably an 80-year-old trapped in a 30-something-year-old body. So I love watching old TV shows. I love going to the dollar store. I love taking naps. That is my favorite hobby of all time, especially being a super busy entrepreneur and public health researcher. Another fun fact, I have never had a brain freeze. I don't know what that feels like. So let me know in the comments, what does a brain freeze feel like? Because I have no idea. My family is super important to me. I am the baby girl of the family. Youngest child, so people might say I'm a little spoiled, but that's okay. And I am also a lupus warrior. I was diagnosed with lupus the first year after my PhD program. So that's a little bit about me, and we'll talk more about that later. But the next thing that we're going to get into is a little bit about my public health journey. And I'm looking at the comments. If you see me looking to the side, I'm looking at my at the comments and the some of my notes here. And so someone said it doesn't feel good. That's all I can say to describe it. Awesome. Okay. So I'll know, maybe I'll have a brain freeze one day and I'll know that it's something that doesn't feel good, right? Okay, awesome. So let's talk about my public health journey a little bit. And also, if you have questions, drop them in the Q&A as well. You'll see that there. In the Q&A box, you can drop your questions in there. So when I first started with my public health journey, of course, I was a lot like everybody else that you might hear. I wanted to be a doctor. I wanted to be in the healthcare field. I wanted to specifically be a trauma surgeon working in the ER, because in my mindset at that time was I wanted to be in a position where people couldn't help themselves, where they were in a dire situation and I could be the one that would be there to help. So let me know in the comments if you ever felt that way, like you wanted to be a doctor when you were growing up. That's how you wanted to contribute to health. So I decided to go to college, major in biology pre-med, right? Because the goal was I was going to go to medical school. I was going to become a trauma surgeon. Well, the first year after my freshman year, Oh, I see we got somebody from Minnesota. Awesome. Glad to have you. So one of the things that happened was the summer after my freshman year of my bachelor's program, I was introduced to what was called the SURE program, which is the Summer Undergraduate Research Experience. And through that program, I was able to work in the lab, in a physiology and biophysics lab. And I realized at that point, oh, well, I can make a contribution to health without ever having to see patients, right? So I didn't know about the research field that in depth until I had that experience. So after that point, I decided, well, maybe instead of going to medical school, I could make a contribution to research. And I am a very analytical thinker. I love doing research. I love asking questions. I love exploring what the answers might be. So from that point, I decided, well, I'm going to go into physiology and biophysics. And it was my first time going to grad school. Now, one thing you should know is that it says Masters of Biomedical Sciences, but the long version of that story is that I started out in a PhD program. Okay. So I started out in a PhD program in physiology and biophysics. And to make a very long story short, when I got through that program, it was terrible. It was very traumatizing for me. And one of the things about it was very hard being in that type of STEM field, a hard science field, as a Black woman. In the school that I attended, I was the only Black student. I was really the only student, period, in a field that was dominated by white men. So that was a lot of pressure on me as a Black woman, especially to perform and under that academic pressure. And so it was a lot to deal with, and it was very traumatizing. And one of the challenges that I faced during that time was dealing with the depression and mental health trauma of grad school. And that's something that we don't talk about a lot, is when we're talking about, should I go to grad school? What should I go to grad school in? What major, what subject? A lot of grad school students struggle with mental health while we're in that program. And so one of the biggest lessons that I learned from that, even though it was a program that I chose and I thought it was something that I would love to do, one of the primary lessons that I learned is that your education should never, ever, ever, ever jeopardize your mental health. Okay, should never jeopardize your mental health. So wherever you are in considering grad school, if you're considering going for a PhD, or even if you're considering going for a master's, make sure that it is a program that is going to serve you, not just academically, but also mentally and emotionally, give you the support that you need to be successful in your academic program. So that's really important. But one of the other things that I realized during that program, remember I said I was in physiology and biophysics, is that I was working in the lab, right? So I'm doing pipettes, I'm working with test tubes and Western blots and extracting proteins and all that sort of stuff. And we were actually learning about diabetes at the time. Okay, so we were learning about diabetes, we were learning about the pancreas, learning about insulin. And as a Black woman, I'm from Mississippi, diabetes runs in my family, right? So I go home, I talk to my mother and my brother, and I say, hey, do you know this is how diabetes works? Like, this is what's happening in your body when you have diabetes. And they look at me with puzzled looks and they say, I have never heard that before. What are you talking about? And so it was at that moment that I said, okay, what can I do with all this awesome information that I'm learning about the human body? What can I do with that to help bring it to the communities who need this information to make more informed decisions about their health? How can I serve them in that way? So I started researching, I started figuring out, okay, public health. What is public health and what can I do with public health? And I found public health education. So working in the lab wasn't enough for me. I really wanted to make an impact in the community and bring information to community members. So that's one of the reasons why I pursued public health education. And during my master's program, that's where I was really introduced to different types of research methods. I know some people ask some questions about, how did your MPH influence your research path, right? Well, although I had some experience in research in the hard sciences, working in physiology and biophysics, it wasn't until I entered my Master's of Public Health program that I learned about different research strategies and methods like qualitative research, like storytelling, community engaged research. And that's where I could really see my passions connect. We have the research field, but then we also have impacting communities along the way, right? So that's where I learned that, is in my Master of Public Health program. But then I encountered another challenge. I loved what I was doing. I loved my program, but I graduated. I was excited. I got through the program, did my courses, aced the test, aced comps, all of that. And then what happens? The graduation high wears off. And then I'm like, okay, I got to find a job now, right? I got to find a job. I got to figure out a way to pay my bills. How do I become a public health professional? Like, I went to school, I did what they told me to do. I did my coursework, I got my A's, but now how do I actually transition to be a public health professional? Drop it in the comments if you know what I'm talking about. Drop a 1 if you know that feeling, like you've done everything, you've done your coursework, but you don't really know how to become a public health professional. And what I realized was that my public health program taught me what to do as a public health professional, but they didn't exactly teach me how to become that public health professional, okay? So at that point, once I realized, okay, I need to figure out how to become a public health professional, my first job out of my MPH program was I was a coordinator for a community-based participatory research program. Through that particular job opportunity, I realized there's a lot more to research than what I have ever known before, because when you learn about it and you do it, those are two totally different things. So I got to the point where I said, okay, I want to explore what else I can do with research, what else I can do with research in public health, and then what else I can do with research in order to impact communities. So that's where I decided I'm going to get my PhD. I went again, okay? Because remember, before I was in the PhD program, I left with my master's in biomedical sciences instead. So I left that program and I decided to do my PhD again. But this time I went for my PhD in education, with emphasis in research, evaluation, statistics, and assessment. Now, fun fact here, if you are considering a PhD program and you want to do public health research, you do not have to get your PhD in public health. You can get your PhD in whatever field you want to. And that's one of the things when you're considering a PhD, get a PhD in something that you are going to be passionate about, because this is something that you're going to be doing for a long time, for a few years, 4 years, 5 years, 6, sometimes 7, like me, 7 or 8 years. So make sure you're choosing something that you're passionate about, and think about how you can bring public health to whatever it is that you choose to do. So for instance, my PhD was in education. So I typically focused on sex education in schools, for instance, most of the time when I was working on projects with my PhD, as well as my dissertation, I focused on professional development and sex education in schools to bring that public health element to what I was doing as far as my PhD is concerned, okay? Drop a 1 if that makes sense for you, if you understand what I'm saying, if you understand what I'm talking about, okay? And then another thing that I had to think about with choosing my PhD program is, do I really need a PhD to do research? I know that question comes up a lot too, because a PhD is an investment. It may be a financial investment. It's a mental and emotional investment. And do you really need it if you want to do research? And the truth is, you don't necessarily have to have a PhD if you want to do research. It's a personal choice. But I know for me, it was the right decision because it was my passion, and I knew that I wanted a career in research, although I didn't quite know what that was going to look like at the time. But I also knew that I really wanted a career focused in research. Now, if you want to teach, if you want to be a professor, if you want to be in academia, you still don't necessarily have to have a PhD if you just want to teach. I don't recommend, if you want to teach, getting a PhD, because you can actually teach on a university level with an MPH. You may be teaching undergraduate students, you may be an adjunct instructor, something of that nature, but you can definitely teach if that's what you want to do with an MPH. So that is, and I know someone asked about consulting. How did I transition from higher education, academia, to consulting? So one of the reasons why I did that was because of the pandemic. The pandemic occurred. My original plan was to become a faculty member. But when the pandemic hit and I saw everything get exposed and all of our public health infrastructure, we knew it was bad, but we got to see it in a different light. And I decided, well, I could use my skills in a much different way, and in probably a much better way than I could working for a university or working for an organization. And I can use my skills the way I need to, and the way that would best serve others as well. So transitioning from academia to consulting is a very long conversation, so we won't get into that right now, but it is definitely something that you can do, and it's definitely an option if you want to consider a different path. Okay, so let's talk a little bit about exploring public health research. What is it and what does it look like to actually work in the field? So there's a difference between community health and public health. And a lot of times you'll hear people kind of use it interchangeably, but there's a little bit of a difference between the two. So let me know in the comments, what do you think the difference is between community health and public health? Just let me know in the comments if you have any idea. And if you don't know, you could just say, I don't know what the difference is. I've never thought about what the difference is. So drop that for me in the comments, if you will. And I'll be looking out for those. I'm going to go ahead and move forward just because of time. But when we're talking about public health, we're talking about kind of in general promoting and protecting the health of the public, of those around us. We may be talking about preventing sickness and injury, promoting wellness, ensuring safety, access to healthcare, health equity. These are some of these general terms that we hear about public health. And ultimately, the goal of public health is prevention, right? Okay. And someone said, is community health a subset of public health? So that is on the right track. So when we're talking about community health, that is when we're applying public health to a very specific group, because different communities, we have different concerns. We have to identify and address unique concerns. I saw somebody was from Minnesota. So a community in Mississippi has very different needs than a community in Minnesota. But we can apply a lot of those public health measures like prevention, promoting safety, those types of things, but it might look a little bit different because those communities are different and they may have different needs. So also when we're talking about community health, we also put a focus on health education, what type of programs we can implement to improve healthy behaviors, community engagement, how do we build those community relationships and build trust with our community members, and then how do we advocate for and communicate with our stakeholders or our community members. And everybody who does public health may or may not have a focus on community health, okay? So I just wanna make sure that we know the distinction between the two, okay? So when we're talking about public health research, we really want to make sure that we're focusing on where this research is going to lead to in the sense of impacting our communities. So when we're talking about research in public health, often we start with a question, right? So we say, why is it that we don't have any grocery stores in this community? Why is it that community members don't have access to health insurance, right? So we ask this question, then we do the research to determine the answers, right, to the question. But then once we get those answers, we need to be able to implement some type of program or a sustainable solution that's going to help us address that question that we originally had. Okay, so I like to call this the public health research cycle. So ultimately, what we're doing in public health research is we're gathering information, we're determining a solution, and then we're taking action on what needs to be done. So for those who are interested in becoming public health researchers, we don't want to do research just for the sake of researching, just for the sake of building our publications, right? Or just collecting data. We want to make sure we're doing something with it so that our communities can have the best impact possible. Okay. Now, when we're talking about public health research and we're talking about this impact on communities, we will always want to remember community members are the experts here. As researchers, we need to challenge our role and think of ourselves more so as facilitators. A lot of times we can think, or traditionally people may think of the researchers as the experts, right? The researchers are the experts or the public health professionals are the experts, but no. When we're talking about public health research, the community members are the experts, because at the end of the day, we want our public health research to lead to a place where our community members can take ownership of their problems and their solutions. They have sustainable solutions that they can keep going even when the public health researchers or professionals are not there, that they have the education that's necessary, the support, the resources, the access, and that ultimately what we're working toward is health equity and social justice for our community members, okay? So what does it actually look like to work in public health research? Okay, what does a day in the life of a public health researcher look like? So the first thing I want you to know is that public health is in everything. No matter what you're doing, there is an element to public health to that. So even when you hear about people who say they are cashiers, right? Or they work at the grocery store in customer service, or you think about the garbage person, right? The sanitation workers, they are making a contribution to public health in what they are doing. So whatever it is, whatever your passion is, you have to think about what is the public health angle to it. If you think about the sanitation workers, right? What would our public health situation look like if the sanitation workers were not in service? We would have some pretty dirty and some pretty trashy and some pretty unsanitary conditions if they were not doing what they were doing. So they are making a contribution to public health every single day. And we don't look at them as public health professionals, but they are, right? If you want anything that you want to do, even if it's in the, I know some people don't think of like medical profession, you'll hear people say, I'm in healthcare, I'm not in public health. Everything is public health, okay? So what we often have to do is change our mindset and think about what is it that I'm doing right now that is related to public health? What's the public health angle to it? What's the public health spin to it? Okay. Now, when you're working in public health research, it is an awesome opportunity to work with communities to gather that information, to determine solutions. It has its rewards. The amount of collaboration that you can do with partnerships and building those relationships is amazing. There are lifelong friendships that I have made being a public health researcher and networking that I have been able to do. Being able to see change as far as healthier outcomes and systems is so rewarding as a public health researcher. Not only that, but a lot of us are in public health because we have a passion for it and because we want to help. If we could do public health work for free, we probably would, right? But we have that servant leader attitude. We're coming in this with empathy and compassion and care when we're talking about being public health researchers and professionals. And then we have growth, right? As a researcher, you get to grow personally, you get to grow professionally. So those are some of the rewards that comes with being a public health professional. But just like anything else, where there are pros, there are also cons, right? So there are challenges. So some of the challenges are, of course, when you're doing research, it's time consuming. You don't get to see the immediate results. You have to be in it for a while before you're able to see it. Then, of course, resources. A lot of times when you're doing research, it may be grant funded. You might have limited human and financial resources, especially when you're working with communities. You might have to do a little bit of outside of the box thinking on how do you get things done, right? Also, culture. If you are a public health researcher or professional, you may be viewed as an outsider to the community. So you really have to take time to build those relationships and understand where you stand with the community, whether you're an outsider or an insider, if you're coming in, if there's some distance that's been created because of things that happened historically that had nothing to do with you, but the community is like, look, we are not going for it, okay? So you have to be aware of culture and then differences as well. Everyone is not going to see things the way you do. Your community members may not see things the way you do. So it's really about making those compromises and seeing what's going to be in the best interest of the community when you are doing research. So now let's get into the nitty gritty. Let's get into the good stuff, right? It's all been good, but now we get into the real good stuff, okay? We're going to talk about opportunities. So how do you transition into becoming that public health researcher or public health professional that you just feel like you were destined to be, right? So these are my top 4 tips for becoming a public health researcher. So first of all, let me know in the comments, drop a 1 if you already consider yourself a public health professional. Drop a 2 if you're saying, well, I'm not quite a public health professional yet, but I'm working on it. Okay, let me know where you are. So a 1 if you already consider yourself to be a public health professional, and a 2 if you're like, I'm not quite there yet. So I see we got a 2, we got 2s coming in. Okay, so my first tip for becoming a public health researcher is you have to change your mindset. And the reason why you have to change your mindset is because if you put a 2 and you said, okay, I'm not quite a public health professional yet, I want you to practice saying, I am a public health professional. Because no matter where you are in your journey, remember what I said earlier, you have done public health in some form or fashion because public health is in everything. Okay, because if you start thinking about it, if you start saying, okay, I'm not a public health professional yet, right? So at what point do you feel like you are a public health professional? What's the thing that makes you a public health professional? It's having that experience, that expertise, right? You already have it. You already have some of it. Now you're continuing to grow. You're continuing to learn. You might consider yourself to be an early career public health professional, right? Because you might be just starting the process, but you are already a public health professional. So that's the first thing that we want to do is we want to change your mindset. If you are continuously saying, I am a public health professional, I'm not one yet. You already are, trust me. But just practice saying, I am a public health professional, okay? So that's the first thing that we want to work towards. Second tip, okay, is you want to focus on building relationships. And when I say building, you've heard me say it a few times throughout this session, but building relationships both professionally and personally early on in your career. And thinking about a relationship is a two-way street, right? So you want a relationship where you can not only be served, but also serve others, okay? So what are some things that you can do to start building your relationships? Number 1 is you want to build a quality network, okay? So I know we probably heard a lot about networking, especially using LinkedIn. You want to make sure that you're building those professional relationships based on quality, not quantity, okay? I don't care if you have 1,000 LinkedIn connections or 1,000,000 LinkedIn connections. If you are not building those professional relationships with people, especially if there are people who are not in the position to serve you and you are serving them as well professionally, then it's not going to make any difference in your career. So you need to make sure that you are building a quality network, looking at the other skills that people have that you can learn from them, skills that you have that people can learn from you. Thinking about what is going to make up a quality network for you. When you are utilizing LinkedIn and you are getting those connection requests, look at their profile before you accept their request to see what is it that they have to offer and what do you have to offer. Are you all aligned? Do your interests align, right? Is there something there that can help? Now, If you don't take any other tip about LinkedIn, this one here is gold, okay? When you are sending a connection request, send a personalized note with the request, letting that person know why you're interested in connecting with them. I assure you that will get you way ahead on their accepting list, right? So make sure you're sending a personalized note, letting them know what it is that you're interested in about them, how you would like for the relationship to move forward. Because what can happen is LinkedIn should be your jumping off point to start the relationship, right? You shouldn't just accept the connection request and end there, okay? You should be accepting the request or sending a request with a personalized note, sending a message saying, hey, I saw that you are a public health researcher. I would love to learn more about what you do. Would you be willing to sit down for an informational interview with me? Or could I talk to you about some information about what you do, what kind of programs may be in your area? Be specific about what it is that you're interested in about them. They may have some research activities that they have going on or know about that you can participate in, either as a community member. You might, and there's no better experience than participating in research activities from the community side, right? They maybe have some activities where you could participate as a research assistant or a volunteer in some capacity. So there may be some opportunities there. And then get to know your community and serve. So not just the people who are in positions of other public health professionals or being in a position to get you a job, but also getting to know the community that's right around you. Where will you be serving and working? Who's in the circles with you, okay? Who are in the trenches? Who is on the front line? Get to know people at those nonprofit organizations around you, because you will be surprised at what type of grant funding and what type of projects and what type of research or evaluation or assessment activities that they have going on. So make sure that you get involved with your community and the people right around you, as well as some of building those professional connections on places like LinkedIn. Okay. Next, we want to talk about diversifying your skill set. So make sure that you're considering, what type of education and training opportunities are going to help to advance your skills in research, evaluation, assessment, and even outreach and engagement as well. So let's talk about skills for a second. So these are some skills that you might come across, some skills that you need to build on. So for instance, when it comes to research, we talked about that's kind of the gathering information stage, right? So we're thinking about theory or theoretical frameworks. You might need to build your skills in searching for literature, what kind of research methods and designs are available, academic writing might be some skills that you need for public health research, right? When it comes to how do we translate that research into a program or a solution, you may need some of those outreach and engagement skills. How do you build those relationships with the community? Talking about assessment and planning, implementation. You might have some instructional skills when it comes to things like curriculum development and how research plays an important role in that, as well as evaluation for program improvement. What other questions do we need to ask to see how do we need to improve our programs? Then when it comes to action, right? Taking action in our writing, in our communication, any type of problem solving, those interpersonal skills, and then how do we offer support and resources? So those are going to be some key public health research skills that you're going to need to diversify in your skill toolbox, right? Now, the next part of this, as far as diversifying your skill set, is what kind of positions, research positions, can you be eligible for, and where can you find opportunities to diversify your skill set? So of course you can have, your online trainings, different programs, different universities. A lot of them have summer programs for public health, doing things right in your community as well. But when it comes to positions, I usually like to think of them in terms of 3 different levels, right? So some people might call them entry level, but I think of it as frontline positions, okay? So you have your frontline positions, which are going to be like your research assistants. Sometimes they might be outreach engagement workers, or sometimes they might be called research liaisons. Those might be some positions that's more so on the front line, boots on the ground, actually doing the research more face-to-face with the community, type research positions. Then you have the next level, which is organization, right? You have your positions that's more so focused on organizing the research activities or the program activities. So you have your research coordinators. They might be called managers or specialists, right? They might have some face-to-face work with the community, but for the most part, they're focused on organizing the activities that sustain the research. Then you have your administrative levels. Now, if you're looking to be more like a principal investigator one day, you may want to consider that that's kind of like that PhD level, right? Securing the grants, being the principal investigator, they are in that administrative role. So they may never really get interaction with the community, but they may not really be coordinating things, but they're more so overseeing all the different activities, making sure everything is done correctly, making sure that deliverables are met, making sure that the paperwork is submitted and done, and those sorts of things. You also might have directors or executives, those types of positions in an administrative level as well. So just thinking about what do those opportunities look like in terms of where your skill level is and then what type of positions are available. Now, we also want to think about what type of places can we work to do public health research. Okay, so there are usually about I think about it in terms of 3 different levels. So you have federal, state, and local. So of course, federal, you got your grant funded programs, you might have federal health agencies. We know the CDC is a big one, but CDC is not the only one, okay? You might also have some service-based programs. For instance, AmeriCorps is a really great program to get introduced to public health in general or some public health activities. It may not necessarily be research, but it's definitely has some opportunities. That's a great introduction and can prepare you for what does it look like to work with the community, right? Then you have your state level, which is of course, you check out your colleges and your universities, your state public health associations. I always recommend anyone who's interested in being a public health professional or a public health researcher, become a member of your state public health association. You have probably heard of APHA, which is the national organization. Okay, so if we have APHA, usually each state has their own state organization. Okay, also your departments of health, your state departments of health will have some opportunities. They usually are partnered with a lot of different local organizations as well. So make sure that you're checking those places out, not just for jobs, but any type of opportunities, programs, trainings that they may have available, webinars. A lot of these places have webinars that you can do as well. And then of course, on the local side, you have school-based, K-12 has a lot of opportunities, for instance, for public health initiatives, nonprofits and private companies. Insurance is a big one. I used to work for a nonprofit organization that helped with Medicaid, helped families sign up for Medicaid and health insurance. And that's something we don't often think about. Also, hospitals and health clinics, of course, your federally qualified health centers are great places to look for opportunities to serve in public health research and community health as well. All right, so in the chat, who can tell me what this object is? What do you see on the screen? What is this object? And this is going to lead us into our 4th tip, okay? So let me know okay, someone said a compass. So yes, so this object is a compass, okay? So what a compass does, and remember I said earlier, I was a Girl Scout, right? So when we would go camping, we would use a compass to tell us what direction to go, right? North, south, east, west, looking at the direction. So what we want to make sure that we do for my 4th tip to becoming a public health researcher is you need to make sure you're gaining clarity and direction by constantly evaluating your own career path, okay? For not just your dream job, because we all kind of have this idea of this dream job that we want to have, but a dream job might not exist, okay? And that can sound scary, but it's not as scary as it sounds, because you might have your next dream opportunity. Each opportunity is going to show you something different about yourself. It's going to give you a lesson. It's going to give you a challenge to overcome. And so the dream opportunity that you have now in your career, maybe as a master of public health student, might not be the same dream opportunity that you think you're going to experience as a mid-level career public health researcher or mid-level career public health professional. So things might change. You're going to have to constantly evaluate what direction you need to take, okay? So this is what we need to do. If you want to gain clarity and direction on your career path, you need to be able to reflect on where you've been. You need to reflect on how you got here. How did you get to this point? What made you want to be a public health professional or a researcher? You need to be able to clearly outline what is it that you want in this season of your life, because seasons change. So outline what specifically is it that you want right now. Identify your strengths and weaknesses. You need a clear strategy and a roadmap to help identify opportunities that are going to serve you, okay? And what you need is you need a compass, right? You need a public health career compass that's going to help transform you to that confident and impactful public health professional that you were destined to be as you constantly move throughout your career and things change and you experience different things, right? So that is exactly what I have created. So for those of you, I know we're getting to the last 10 minutes of this call, and I'll get through the questions and answers as well. But I just want to share this with you, is that I do have a program. It's called the Public Health Career Compass. And that's exactly what we do. So we spend about 2 hours working with you to gain clarity and direction for your career, to really help you overcome those feelings of inexperience. Like, I'm not, that feeling that we talked about earlier, that I'm not a public health professional yet. So we help you to kind of overcome that so that you can walk away saying, well, you know what, I am a public health professional. We take an in-depth look at the career outlook for what you're interested in. We do some personal reflections, some professional reflections. You leave with a tailored career roadmap. You'll have a more expansive list of job titles and positions and places to work as a resource guide. So if you all are interested in that program, you can go to joyeewashington.com/PHCC. And I will also put that in the chat as well. Let me see if I can put that in the chat real quick. Give me 1 second. All right, so you can go to that link in the chat and you can join the wait list for when we open. Okay, so we do have that available. And let me look at these questions and answers real quick. Do I need to be under a specific umbrella to do public health research? So no, you don't have to be under a specific umbrella. Public health research has a ton of different topics, a ton of different paths. And like I said, things might change. The niche that you think that you want to do today might be very different than what you might want to do 5 years from now. So I always tell people, when you're thinking about public health research, don't be afraid to explore different areas of public health research and really follow your passion, follow what it is where you would like to serve, because public health research is a lifelong service opportunity. Okay, you're going to be doing it for a long time. So think about exploring what else is out there and what best resonates with you and how you can best serve with your skill set. Okay. And then someone else asked, how did you start a public health consulting company? So the way that I started it is I just took one step at a time. Okay, I decided that I wanted to do it, number one. So you have to make the decision that you want to start a consulting company. Then make sure that you get educated on the business side of starting a consulting company. So I know for me, I knew the public health material, but I was not as familiar with the business side of things. I don't have an MBA. I have never taken a business course ever. So I really had to take time to learn the business side of things when it came to building a consulting company. And you don't have to build it overnight. You know, you take one step at a time, and the way your company evolves and changes, especially during the first few years as you're figuring things out, it will be challenging, but I will say it is definitely worth it for me, for starting a consulting company. And I'm still learning, I'm still figuring it out. So I would definitely say that's kind of the first thing that you want to do is learn about business. If you don't know about business, make that decision that you want to start a public health consulting company, and then learn as much as you can about the business side of things, before you go down that route. Okay. Let's see. So that kind of concludes my presentation. And someone asked in the questions, what would cause you to stop public health research? And honestly, I couldn't think of anything. I think we'll always have some element of public health research. And we always want to have the tools and strategies available to make an impact in our communities and make sure that our communities have the resources that they need as well. Okay. And someone asked, what resources are you using for business skills? So there are a few that I could recommend. If you're interested, your local small business development center is going to be the best place to get free resources. It is a government funded program by the Small Business Association. So check into your local small business development center, and they usually have free webinars and free resources. You can often work with a counselor, a business counselor, to help you get started. And usually if you just Google your state and then you just say, so if you're in Minnesota, it might be Minnesota Small Business Development Center, and you should see stuff come up. Another source is called SCORE Mentors, so SCORE. SCORE Mentors is another resource where you can get someone to help mentor you through the business process. So those would be two for sure, that would help you get started on the business side of things, and kind of learning, you know, the in and outs of putting together a business plan, marketing. How do you get your LLC? Do you need insurance? What kind of legal things do you need? Do you need any kind of permits based on your city or state? Any type of licenses to do business in your city and state? So those will be a couple of resources that I would for sure recommend on how to get your business started as a public health consultant, if that's what you want to do. And just thinking about, you know, what kind of skills do you have that could potentially help service communities or service in public health research, because we all have unique skills. So I guarantee you it's enough problems out here, and it's enough going on that we probably won't be able to have enough public health consultants to do what we need to do. So if that's definitely a route that you want to take, I definitely say go for it, but do your research first on what does it look like to run a business, because that is a different ballgame for sure. Okay, any other questions before we get ready to close? We also make sure you do the evaluation in the chat as well. Let's see, and now we're going to get ready for our giveaway. So let's see, I'm gonna stop share. And before I stop share, the giveaway will be a one-on-one career strategy session with me. So whoever is the winner, you will get a very special email from me so that you can sign up for a special career strategy session.